Good morning, dear students. Today in our class, we are going to discuss about the direct retainers of removable partial denture. So we have already covered the other components such as major connectors and minor connectors. And today we are discussing about the retaining components, main retaining component of direct retainers. Direct retainer is by definition is a component of partial removable denture prosthesis used to retain and prevent disgorgement, consisting of a clasp assembly or precision attachment. So it can be a precision attachment or a clasp assembly. Anyway, these components are giving retention to the denture. So that is the component which makes your denture stable in your mouth, which retained in your mouth. What is direct retention? The retention obtained in the partial removable dental prosthesis by the use of clasp or attachments that resist removal from the abutment teeth. So it's a retention obtained in the partial removable dental prosthesis by the use of clasp or attachments that resist removal from the abutment teeth. Now we will see the classification, how the direct retainers are classified. It's broadly divided into two components, two portions, one intracoronal retainers and extracoronal retainers. So the retainers which engages the tooth intracoronally inside the crown is known as intracoronal, and the retainers which engages the tooth externally is known as extracoronal. Under the intracoronal, you can see different attachments, mainly key and keyway attachment. And under the extracoronal, is again broadly divided into attachments and clasp. Attachments and clasp. Clasp can be broadly classified into circumferential clasp and bar clasp. Circumferential clasp is the clasp which approaches the crown from above, and bar clasp are the clasp which approaches the component which approaches from the gingival. So it is known as bar clasp. Under the circumferential clasp, there are cast circumferential clasp or combination circumferential clasp. Combination means combination of different methods. Cast circumferential clasp is the most common clasp assembly which uses in the removable partial denture for getting direct retention. Intracoronal direct retainers or precision attachment. The definition is a retainer consisting of a metal receptacle, otherwise known as matrix, and a closely fitting part, matrix. The matrix is usually contained within the normal or expanded contours of the crown on the abutment tooth, dental implant, and the matrix is attached to the pond or the removable dental prosthesis framework. Precision attachment or internal attachment. Intracoronal attachments. There are prefabricated attachments. These are prefabricated attachments positioned within the normal contour of the abutment tooth. So these are the attachment positioned intracoronally inside the abutment tooth, and it is also called as internal attachment or precision attachment. And these particular intracoronal attachments are developed by Dr. Herman E.S. in 1906. It consists of male and female component. The female part is called matrix. It's a receptacle placed in the abutment tooth intracoronally. A male part, matrix, is the male part is otherwise known as matrix. I already mentioned. Is an insert. It's an insert which is processed into the denture. So you can get two components in the intracoronal attachment. One is female part and a male part. Female part is known as matrix and male portion is known as patrix. The female portion is prepared inside the crown. That is why it's it is termed as intracoronal attachment. So as this picture suggests, you can see the upper area. You can see the red mark, which is the female part. It is prepared intracoronally, or it can be incorporated in a crown or a extracoronal fitting, like a crown can be prepared, and it can be prepared inside the crown, incorporated inside the crown. Or you can see the next portion, down portion, you can see the male component of patrix, which is connected to the framework. Advantages of this is it has got some advantages. It eliminates all the visible retentive component. You can see in the extracoronal retainers, you can see a lot of component is visible outside. It is exhibiting outside, so it is anesthetic. Here it is not visible, so it is more aesthetic compared to the extracoronal. And also visible support is eliminated. And it provides some horizontal stabilization, but additional stabilization is desired. That is the problem. Greater stimulation to underlying tissue because of intermittent vertical massage. So it gives additional stimulation of underlying tissues. But the main disadvantages are it requires preparation of the abutment. Since the female component is inside the crown, either you have to go for a preparation of a crown, or you have to make a female portion to receive the patrix inside the crown. So it needs a alteration of your existing tooth. That is a disadvantage. For the extracoronal, it is not mandatory that you have to alter the crown structure. And it has included some complicated clinical and lab procedures. Okay, it is not as easy as our extracoronal manufacture. Loss of retention due to wear, repair and replacement is difficult, and difficult to place completely within the tooth. And cost, another disadvantage is increased cost compared to the extracoronal retainers. But these type of intracoronal retainers are contraindicated in certain situations like presence of large pulp. That is in such area, such situations, it is very difficult to prepare the crown for making a bed for your male component. And the second is short and braided teeth, as they are prefabricated, length may be insufficient. And third one is distal extension bases, do not permit horizontal movement. Since it do not permit horizontal movement, distal extension cases, if you give this internal attachment, there will be leverage force which may end up in the failure of the processes and the failure of the primary abutment. Now we are moving on to the extracoronal retainers. These provide retention through components placed outside the normal contour of the abutment tooth. We have seen the intracoronal retainers are placed inside the confines of the tooth, where the extracoronal retainers are placed external to the confines of the tooth. And it is broadly divided into prefabricated attachment and clasp. Prefabricated attachment and clasp. Clasp are mostly used extracoronal retainer actually. Clasp assembly is a part of the removable denture processes that acts as a direct retainer and or stabilizer for a prosthesis by partially encompassing or contacting an abutment tooth. Clasp, the component of the clasp assembly that engages a portion of the tooth surface and either enters an undercut for retention or remains entirely above the height of contour to act as a reciprocating encirclement. So actually the class has got two components. One is retentive component and one is reciprocating component. That is what we explained here. And we will see what you mean by undercut. Undercut is a portion of the surface of an object that is below the height of contour in relationship to the path of placement. So undercut areas are very much required for the retention of the denture. So the retentive terminal of your class assembly will be engaged to the undercut to get retention. Okay. Now the next terminology is height of contour. It is a line encircling a tooth and designating its greater circumferences at a selected axial position determined by a dental surveyor. A line encircling a body designated its greatest circumferences in a specified place. It is the maximum bulge area to which a corresponding survey line is marked. So that is height of contour, the maximum bulge area. Below that, below the maximum height of contour will get undercuts. This class can be two types: circumferential or adverse class, which approaches an undercut occlusally. So it's otherwise known as occlusally approaching class. Or the next category is gingivally approaching class. Occlusally approaching class are cast circumferential class and a combination class. And the vertically approaching class is otherwise known as bar class or Roche class. It approaches from down, from gingival. So you can see in these pictures. The first picture shows how a cast partial or simple circular class is level. You can see the upper portion is a retentive arm, and lower portion you can see a reciprocating arm. Here the second picture B, you can see the bar class, how the class is approaching from gingival. So it engages gingival. So the exhibition of the class components are very less externally. That is why bar class is considered as more aesthetic than the simple circumferential class. Now we will look into the component part of class assembly. A class assembly consisting of a rest, the retentive arm. The retentive arm got three parts: retentive terminal, body, and shoulder, and reciprocal arm and minor connector. So class component as a class assembly has got mainly four components: rest, retentive arm, reciprocal arm, and minor connector, which connect the class into the major connector. That is the four parts of the class assembly. You can see that it in the picture. You can see the right side. You can see the reciprocal arm. C is marked as a reciprocal arm, and B is a retentive arm. And you can see the D minor connector for the denture base. D minor connector for the denture base. And here is the rest. Okay, these are the major components. This is the minor connector which connects the class assembly to the major connector. Now, what is a rest? Rest provides the vertical support or prevents tissue word movement in the processes. So that is the main component of the class assembly, which gives support to the denture. All masticatory forces is falling onto the teeth will be transmitting through the major connector and ultimately transmitting to the abutment teeth through the rest. Rest and it directly to the rest seat. And along the receipt, transmit to the long axial tooth. Three parts of rest. Terminal third is flexible. Terminal third is flexible and engages the undercut area. Middle third is limited flexibility, and so this is a direct retentive arm. The three parts of retentive arm. There are three parts of retentive arm: is terminal third, middle third, and proximal third. Terminal third is otherwise known as retentive terminal, which engages the undercut. Middle third, it is limited flexibility and may engage into the minimal undercut. And proximal third for body, flexible and is placed above the height of contour. See the three parts of the retentive terminal, and blue one is shoulder, and B blue one is body, and B is shoulder. So most flexible part is retentive terminal. Less flexible part is B, and rigid portion is C. Board. Now we come to the reciprocal arm. Clasp arm is placed above the height of contour on the surface of opposing the retentive arm. It resists lateral force extended by a retentive terminal as it passes over the height of the contour during removal and insertion of the partial denture. Functions of reciprocal arm are: it is a reciprocation against the action of retentive terminal. It reciprocates the action of retentive terminal and prevent the orthodontic migration of the tooth. And it helps in stabilization against the horizontal forces. It contributed also to the vertical support and indirect retention. So it can act as indirect retainer, and since it is placed in the above height of contour, it can give a mild level of vertical support as your rest does. So retentive terminal is the distal third of the retentive arm. Is only component that is placed below the height of contour. It is the retentive terminal is the portion of the clasp which placed in the undercut to get the retention, and body connects the rest and shoulder to the minor connector, and shoulder connects the body to the clasp terminal. Now we are coming to the minor connector part of the clasp assembly. It joins the body to the remaining part of the framework and gingivally approaching clasp, which is called approach arm. Requirements of clasp. You can see 6 requirements of a clasp. When you make a clasp, these requirements should be met: retention, stability, support, reciprocation, encirclement, and passivity. Once more: retention, stability, support, encirclement, reciprocation, and passivity. The retention is the quality inherent in denture that resists the vertical forces of dislodgement. Okay, so retention is the property by which it resists the displacement moment against the path of insertion. Okay. And factors affecting retention are dimensions of retentive undercut. It can be a buccal width or distance between the survey line or the mesiodistal length. Okay. You can appreciate all this in the picture. Length of the clasp. When length of the clasp increases, flexibility of the clasp increases. So it can engage in the deeper undercut. If it is a shorter length, the flexibility is less, so you cannot engage into the deeper undercut because it will exert more strain to the tooth. That is what I told: flexibility of the clasp arm. Now the stability, the quality of the process is to be firm, stable, or constant, and to resist displacement by functional, horizontal, or rotational stresses, and support the resistance to displacement of the processes towards the basal tissue or underlying structures, provided by occlusal, lingual, and incisal rest. Reciprocation, we already discussed the mechanical by which the lateral forces are generated by the retentive arm passing over a height of control are counterbalanced by the reciprocal arm passing along the reciprocal guideline. What is another other requirement is encirclement. Encirclement. It's a property of the clasp assembly to encompass more than 180 degrees of the abutment tool, either by continuous or broken contact to prevent dislodgement during function. The last requirement of the clasp is passivity. What do you mean by passivity? It is a quality or condition of inactivity or rest assumed by the teeth. Tissue and denture when a removable dental process is in place, but not under masticating pressure. So when your entire appliance, entire removable partial denture is seated inside the mouth, if it is not functioning, the entire clasp assembly, wherever you have provided the clasp assembly, the whole clasp assembly should passively engage. It will activate only in the functional stage. Otherwise, it will cause orthodontic migration of the tooth. Now we'll see what meant by circumferential clasp. So it is a type of extracoronal retainer, circumferential clasp. A retainer that encircles the tooth by more than 180 degrees, including opposite angles, and which generally contact the tooth throughout the excellence of the clasp with at least one terminal located in another. So it is a closely approaching clasp. It has got a reciprocal and retentive arm, and only the retentive arm will be engaged with the undercut. Cast circumferential clasp is also called Acker's clasp. Cast circumferential clasp, the synonym for the cast circumferential clasp is Acker's clasp. All components of the clasp assembly are made of cast alone. Retentive terminal should originate above the height of contour and terminate below it. But we have already seen. Retentive terminal should point towards the occlusal surface and never towards the gingiva. The retentive tip should only terminate in mesial or distal line angles of the tooth, never in the middle of facial or lingual surface. So clasp arm should be kept as low as possible to gain mechanical advantage against any lever action on the tooth. This is the retentive undercut, which is placed below the height of contour, and you can see how the retentive tip is placed in the, it's already explained. And this is the reciprocal arm. You can see the reciprocation arm is kept above the height of contour. It should not pass the height of contour. If it passes the height of contour and engage in undercut, it will become a retentive component. Now, advantages. Easiest circumferential clasp advantages are easiest to design, easier to construct, easy to repair. It gives excellent support, bracing, and retentive qualities. Most logical choice for two-supported removable partial dentures. And it costs less food retention. And many types of this clasp are available, so it can be used in most situations. So circumferential clasp can be designed which can be selected according to the situation. But there are some disadvantages, and it has got more tooth contacts, tooth coverage, so that it can lead to the decalcification. And it might alter the morphology of the abutment because the wood occlusal table of the tooth can alter by increasing the components in the extracoronal area. And if positioned high on abutment, that can increase the width of the occlusal table, which can cause greater occlusal forces to be exerted on the tooth. And it is difficult to adjust with the pliers. You cannot adjust it with pliers like hot wire. If you try to adjust it with the hot wire, it might break. Once it breaks, you have to remake it. You cannot do anything on it. Types of cast circumferential clasp are, so there are different cast circumferential clasp, the simple circulate clasp and the reverse circulate clasp and multiple circulate clasp. You can see different embrasure clasp, which is placed in the embrasures of the tooth, prepared to rest it on different adjacent tooth, and we place embrasure clasp, and it can be a ring clasp. These are the other simple circular clasp, which will be discussed in the next class. Okay, so the direct retainers, as we discussed, direct retainers are the main retentive components of cast partial denture, and it is mainly divided into what all direct extracoronal and intracoronal. Intracoronal retainers are otherwise known as precision attachment or key and keyway. It has got two components, matrix and matrix. We have already discussed, and it has got some advantages over the extracoronal clasp because it is more aesthetic, but the disadvantage is it has to be prepared by altering the existing anatomic crown. That is the main problem. But on the extracoronal retainers, single circular clasp are very easy to manufacture compared to the precision attachment. It has got multiple choice and it can be selected according to the case. So in the next class, we will be discussing about the types of type of extracoronal clasp. Thank you.